Well, pivotal in the Omicron fight, Pfizer revealing its vaccine booster shot offers significant protection against the variant. Joining me now, Dr. Alex Jahangir, Nashville Coronavirus Task Force Chair. Doctor, great to have you with us. Tell us about what's going on with Pfizer and what they're finding with their vaccine.
Sure, thanks for having me, and I'm so glad your Christmas tree's being put up out there.
Yes.
Listen, what this study is showing is that the third dose of the Pfizer shot, the booster shot, is increasing the antibodies 25 times to the Omicron variant, which hopefully will continue to give protection to this new mutant variant that's starting to spread across the country, which is really good news for everyone. And really the take-home message is get your booster shot so that you're protected against this mutation and others.
So that's Pfizer. What about Moderna and J&J? Do you see something coming on those fronts as well?
You know, the studies haven't come out yet. My guess is the Moderna vaccine, since it's so close to the Pfizer one, will probably have similar results. And really, I think it's not. There's been no public story around the Johnson & Johnson vaccine. But again, I think it just shows that antibody levels are important. But here's the thing: the T cell response to the infection is something that can't be measured. And so what we don't know is if somebody has received the vaccine, will they still have immunity from the T cell immunity? And that's something that just time will tell as well.
So that's the vaccine story. I want to talk about the treatment story as well. GlaxoSmithKline says its antibody-based COVID-19 therapy is effective against all mutations of the new Omicron variant. What else are we seeing on the treatment side that's giving us some hope that this is very manageable?
Well, I think what you just mentioned, as well as Merck and others have put out now drugs that can be taken as an oral pill, kind of like you do when you get the flu. You can get the Tamiflu if you're tested early enough. And I think all of that gives us a lot of hope. You know, we're in a very different place today than we were 1 year ago. We have the vaccines, but in addition, we have treatment modalities such as these new pills coming out, monoclonal antibody therapy that's still very robust in this country, that if you do become infected and you test soon enough so that you're within that window, you can really get some treatments that will keep you from getting severely ill. So all is really good news. Again, I think the take-home message, though, is it's important to know if you are infected. That's why easy access to testing at home is really critical. And then besides that, everyone should get vaccinated. And if you're 6 months out from your Pfizer, Moderna, get your booster. And it seems like we hopefully will be at a good place to continue everything we enjoy doing.
Doctor, really quickly, what about natural immunity here? I think that gets left off the table all the time. What are we finding in terms of the protection that natural immunity, getting the virus in the first place, is offering to people in this Omicron situation?
Well, you know, I think that it's a little too early to know for sure with Omicron, but people who've recently been infected do have a level of immunity and antibodies that do protect you from getting severely ill the next time. The problem with natural immunity is it's hit or miss as far as how long it lasts or doesn't last. And so there's more robust data to know the vaccines allow for a more stable amount of immunity, although as we've seen, 2 doses of the vaccine appear to maybe not stay long-term either. But I think we can't ignore the fact that, especially with the Delta wave that just happened, with a lot of people who've received natural immunity from that, there is some level of protection that probably is not measurable, but is real, and we should be aware of that.
Yeah, we ought to be aware of it, and I think we ought to keep it in mind. It gets pushed aside too often, but we appreciate your message today, Dr. Alex. Thank you so much for being with us.
My pleasure.
Well, look at the markets at the close. Stock